Hello friends, this is Shannon Joseph. Today I'm going to be teaching about folic acid deficiency anemia. First, let's begin with the definition of anemia. Anemia is the reduction in the total number of erythrocytes, that's the red blood cells in the circulating blood, or a decrease in the quantity or quantity of hemoglobin. And they usually result from impaired production, blood loss, increased destruction, or a combination of these three factors. So now I'm going to be focusing only on folic acid anemia that is caused by folic acid deficiency. So folic acid deficiency causes a decreased or defective production of the red blood. The pathophysiology involved is folic acid deficiency alter the DNA synthesis, and which leads to ineffective erythropoiesis, and then because the red blood cells are defective, it causes premature cell death. And the morphology of the red blood cells when you see them on peripheral blood smears are on the peripheral blood smear is macrocytic normochronic anemia. The red blood cells are large, abnormally shaped erythrocytes with normal hemoglobin concentration. What are the causes of folic acid deficiency? Folic acid deficiency can occur from inadequate ingestion of folate containing foods. You see that in chronic alcoholism and poor nutrition intake. And then there could be impaired absorption. The absorption of folic acid takes place in the intestinal wall, and if there's any block to their absorption, you get a folic acid deficiency. Though you have a normal nutrition intake, if it is not absorbed into the blood, it causes a folic acid deficiency. Then impaired metabolism leading to inability to utilize the absorbed folate. So once the folate is absorbed into the blood, there's various metabolism that takes place before for the formation of new red blood cells. So if there is an impaired metabolism, that could also lead to folic acid deficiency. And then there is when there's an increase in requirement, like as children's growth spurt, during lactation, during pregnancy, there is an increased demand, and if the body is not able to meet the demand, then there would be a deficiency. If there's an increased excretion or loss, if there are various causes that causes, there are various reasons that causes an increased excretion of the folic acid, then you will have folic acid deficiency. The last one is increased destruction. So what are the clinical features of folic acid deficiency? They present with sore tongue or pain on swallowing. The tongue will appear swollen, beefy, red or shiny, and around the edges and tips initially. They can also present with angular stomatitis. GI symptoms such as nausea, vomiting, abdominal pain, diarrhea, especially these symptoms are aggravated after a meal. Anorexia is also common, and in combination with the other GI symptoms, there may be a marked weight loss. Neurological presentations include cognitive impairment, dementia, and depression. The neurological presentation is common when it's seen with vitamin B12 and folic acid deficiency. So the lab study we do is folic acid level, serum folic acid level, and the reference range is between 2.5 to 20 nanogram per milliliter. Most of the patients with folic acid deficiency can also be deficient in vitamin B12, so you also check for serum vitamin B12, and the reference range for serum vitamin B12 is 200 to 900 picogram per milliliter. So now let's review the treatment. Basically, the treatment for folic acid deficiency is replacing folic acid. We could do it through dietary replacement. Fruits, vegetables, and fortified foods constitute the primary dietary source for folic acid. The recommended intake as published by the Food and Nutrition Board at the Institute of Medicine at National Academies are as follows. For adults and teenagers aged 14 to 19, male or female, the recommended daily allowance is 400 microgram. And for pregnant females, the recommended daily allowance is 600 microgram. And for lactating females, the recommended daily allowance is 500 microgram. And then you have medication. You can supplement through medication too. And the goal of the medication therapy is to eliminate the deficiency, reduce morbidity, and prevent complication. So you have folic acid supplementation. So folic acid is a cofactor for enzymes involved in the production of red blood cells. So it replenishes the depleted folate stores. The dosage that you usually give is 0.4 to 1 milligram, available as oral, IV, intramuscular, subcutaneous once daily.